Welcome to our presentation of our work on disparities in COVID-19 pathogenesis and long-term outcomes. This pilot project is composed of two main research goals. The first is to determine the acute clinical and immune outcomes of moderate and severe COVID-19 and identify differences in disease progression, mortality, and risk factors across demographic populations in inland Southern California. The second goal is to conduct a follow-up study on recovered patients to determine the long-term effect of COVID-19 on the immune system and lung health. This project was driven by the overarching hypothesis that Latino populations in inland Southern California would be at higher risk of infection and poor health outcomes. The rationale for this hypothesis was that high exposure risk occupations such as healthcare or service industry jobs would increase the risk of infection and worsen the viral burden, while other occupations which increase exposure to dust and pollution would impair lung function. Additionally, we predicted that a high prevalence of comorbidities that impair inflammatory signaling and immune function, such as diabetes, would be associated with worse health outcomes. Our study utilizes several layers of community engagement. In AIM-1, we work closely with local clinical collaborators to recruit patients, collect samples, and conduct our preliminary analyses. Also during this phase, we maintain continuous one-on-one communication with individual participants, and we share their clinical results, including PCR test results and viral variant information. We're currently beginning AIM-2, in which we conduct a long-term follow-up study with surviving participants. Finally, at the conclusion of the study, we will prepare a symposium to share results with participants, their families, and local clinical partners, as well as the wider Riverside County community. This event will allow our local community to also provide input, which will guide our future research questions. This is an ongoing study. We've currently recruited 31 moderate to severe COVID-19 patients requiring intensive care, of which 88% identified themselves as having Hispanic ethnicity. We also recruited 27 patients with mild disease, of which 27% had Hispanic ethnicity. The majority of our samples until October 2021 contained the California variant, and Delta and Omicron were more common since October. Our hypothesis that high exposure risk occupations would lead to higher case rates and increased disease severity is not supported in this preliminary data set, as only 25% of all recruited participants had high exposure risk occupations. We identified a trend for increased age in participants in the ICU group, but there was no significant difference in the age of patients who survived versus those who did not survive in this cohort. Among our ICU cohort, 48% of patients survived and had an average time in the ICU of 14 days. Interestingly, 2 patients were actually readmitted to the ICU with reinfections, and 11 patients in the full cohort had received 1 or more dose of vaccine at the time of infection. As we hypothesized, hypertension and diabetes were both very common in ICU patients. 70% of patients who survived and 77% of patients who did not survive had hypertension. Diabetes seemed to be more common in patients who did not survive. Obesity was common as well in the ICU cohort. While I don't have time to discuss the detailed immune function results, I will share a couple highlights here. We see significant reductions in both classic and non-classic monocytes in patients with more severe cases. This reduction in monocytes would greatly impact the ability of the body to fight infection. Additionally, we measured levels of circulating spike protein in the plasma. This spike protein is cleaved from the virus upon binding to a cell surface and becomes free circulating in the blood. It's thought that this free circulating spike protein may have implications for cardiovascular function. We found that patients with more severe disease had more circulating spike protein at time point 1, but that it was reduced as the disease progressed to time point 2. In conclusion, we see that treatment is improving and mortality is decreasing. Our data also supports that of other groups in that proper management of diabetes and hypertension can lead to better outcomes. Moving forward, we will continue our clinical recruitment, and we're beginning our long-term follow-up study. We aim to determine if long COVID has disproportionate impacts in Latino communities in inland Southern California. Thank you very much for listening, and feel free to contact us with any questions.